Co.nz. It's time for our panel. Thank you very much for joining us. Tim Wilson, Maxim Institute Executive Director, and Maria Slade from Business Desk, Senior Reporter. Well, first of all, Maria, this is a pretty huge day, right? The significance of this report is significant. And what do you make of these rankings, which are pretty fascinating? Luxon at 13th.
It is a bit surprising that the Prime Minister comes so low in the rankings, and yet it's not, because we know that he's not a Prime Minister that's really kind of hummed, if you like. You know, he hasn't got the charisma of a John Key for a start, and I think that's never sort of helped him. But I think also there's just huge frustration at the state of the economy. We just can't seem to, you know, get a break, really. Look at those GDP numbers that came out the other day, even though people are saying, you know, probably it's a matter of statistics and things will come right this quarter. But, you know, people never look favourably at a government when the economy's in the doldrums.
Yeah, that's true. I mean, Tim, what's your assessment on this? I see that Erica Stanford right up there, and Winston.
Yeah. Look, I'd pull it back. I mean, historically, I think Christopher Luxon came in as more of a manager-style leader as opposed to the visionary leadership of Dame Jacinda Ardern. So he was an antidote. So this is his way of doing it. There's clearly a desire for greater vision now, and I think in the case of Erica Stanford, what's it all been about with her? NCEA. Okay, I'm going to fix NCEA. So it's like pick a focus, get in there. But I will say that generally the cabinet seems to be rated pretty well. So if your colleagues and the people you lead are doing well, then by reflection, you're doing well. However, it just doesn't look that good.
Yeah, and I mean, just on Luxon's rankings, Maria, I mean, do you think he's got time to sort of pull it back? I mean, he said to me on this program the other day he's expecting this kind of uplift by Christmas. I mean, that's what he's hanging out for, isn't he? Some good news, some good economic news.
Waiting for an upward draft or something, is he? Look, I think my colleague Dileepa Fonseca makes quite a good point in Business Desk this morning when he says that probably one of the things they fear the most is a change of government next year, that the country is so sort of, annoyed with the state of the current government, or the performance of the current government. They'll vote them out after only one term, and then we're in the situation again where we get a new government and just starts unravelling everything like this one has done. And that change, that constant churn and change, is possibly what they fear the most, rather than being really annoyed with a national government. Because, as we know, business favours a centre-right government, and so it's not that they disagree with their general direction of travel as such, it's just that they haven't managed to sort of get much done in 3 years yet.
Okay, look, we're going to come back shortly because we've just had a bit of a microphone malfunction. Should see you after the break. Okay, we fixed the dodgy microphone and we're back with our panel this morning. Tim Wilson, Maxim Institute Executive Director, and Maria Slade here from Business Desk. Thanks for being here again, guys. So, Tim, Trump, let's just pick up on this, the paracetamol and autism claims. What did you think when you read or heard him talk about this?
Yeah, look, the wider context of this is that Trump's a populist politician, and a lot of people are more than sceptical about Big Pharma. Okay, and he campaigned with RFK to take on Big Pharma, maybe not take it out. This is not unexpected, that's what I thought. And he was very much, Bobby wants to be careful, I don't want to be careful. And this is the sort of Trump special sauce, which is a kind of authenticity of some kind. And in a world where so much communications are stage managed and people think, oh, I'm not being told the truth or what people really think, I think this does generate some cut through for him.
Yeah, so do you think this was all part of a political strategy, Maria?
Oh, it's all very carefully stage managed, absolutely. The way he just ignores the entire body of modern medical science and go, oh, well, it's just my opinion, but just putting it out there kind of thing. It's so dangerous that you might suggest that paracetamol causes autism, and things like, oh, well, they don't have it in Cuba. Yeah, but Cuba's pretty much a third world country where autism is probably very much underdiagnosed anyway.
Because the diagnosis, the ability to diagnose it would be very mixed in a place like Cuba.
Exactly.
Which, by the way, as I recall, is a communist state. I don't know if America wants to be like Cuba.
Well, that's right. And it's just so worrying that America's going further and further and further down these kinds of rabbit holes, and things like the Jimmy Kimmel situation, we've seen in the last week or so. Apparently he's being reinstated, but the idea that the state can say to a media outlet, right, we're going to rip away your broadcasting licence if you don't hi-ho, it's beyond our sort of framework, really, in New Zealand, and it's so hard to understand that the Americans go for this kind of a leader.
Well, that's one of the key points, isn't it, right? I mean, you've got Trump, but he's saying stuff like this, baseless comments, dangerous comments, but it's clear that people like what he's saying. It's popular, and so he doesn't care about trashing science or peer-reviewed reports.
Well, the way they have politicised the death of Charlie Kirk, the death of that commentator has just so played into the Republican political playbook. It was a gift to them, really, and they have made the most of a really awful situation.
And that's actually one of the unappealing things about this, because this is actually personally a huge tragedy, the death of a 31-year-old father of 2 kids, and someone who I would say sort of attempted, on most cases, to disagree agreeably with people and to actually front up with them. And it's to see the political power play. It is a bit unseemly, but that's American politics.
I
thought it was pretty gross. I mean, you had Trump even at that memorial service. Basically hinting at his announcement, his political announcement the next day about autism. I mean, it just felt wrong.
Yeah, it's very distasteful to the New Zealand way of doing things, that's for sure.
Okay, Christchurch Hospital's ED. We know that every winter things get really bad, but it appears to be at crisis point at our busiest ED. Is New Zealand plunging into third world healthcare?
You'd like to know more about what the reasons are behind that, whether it's a case of lack of staff, whether it's a case of people fronting up to ED when they possibly should be going to their GP first, which is often a problem, whether Christchurch is particularly short on resources compared to other EDs around the country. We know that Middlemore always struggles. It does seem like it is a crisis that needs more resources put into it, because it just seems getting worse every winter. And it's hard to know why it's not being addressed. What's needed? Why are we continuing to spiral into this problem every winter?
Well, space and not enough staff. Where do you stand on this? I mean, consecutive governments appear to have failed to address this issue over a long time.
Yeah, and this is a multivalent structural issue in terms of health, and a heartbreaking situation for the staff that work in there, the doctors, the nurses. Hats go off to them. In the sense that you're referring to GPs, many people. The numbers of GPs are going down. Many of them are over 60, they're retiring. Many GPs, they closed their books between 2018 and 22 because they're at capacity. Will more money fix this? Well, actually since 2019, we spent 25% more on health, but we've also had 400,000 people come in through immigration. So there's a lot of buttons that we've got to push here to get this right, but we need to do it.
Okay, guys, we've got to leave it there. Thanks so much for joining us this morning on Herald Now. Tim Wilson, Maxima Institute Executive Director, and Maria Slade, Business Desk Senior Journalist. Well, it is 8:35. Here's Neve with the news.